All right, everybody, this is our sixth and final episode of the 5 pillars of chronic disease. Today, I'm going to talk to you specifically about increased stress hormones. So guys, remember that your nervous system, which is your brain, your spinal cord that runs right down the middle of those spinal bones, and the nerve roots that go out from the spine all the way into every single cell, organ, and tissue in our body. The nervous system is responsible for understanding if there is a perceived stressor or something that is threatening coming into our life. This could be in the form of something physical, like if you were to have a bus coming for you, right? As you're walking across the street, that would be very acutely stressful. This could be something that you're having go on in your thoughts, or something that you visualize, like let's say during a dream where you have very intense emotional stress that can be created because it's a perceived threat, or this can be just something that is a passing moment that goes by you. Either way, stress changes the way that your body functions. And as we've talked about in this series, your body's really good at being able to manage short-term stress. However, the concern, especially in the modern world, is that we are under long-term chronic stress day after day, week after week, year after year, decade after decade. Accordingly, the body has no good way of being able to manage this type of problem, and accordingly, it leads to disease. Now, when we talk about these 3 different types of stress hormones, we have adrenaline, we have cortisol, and we have noradrenaline. Let's talk about cortisol first, actually, because I really like this concept of looking at this. Remember, all 3 of these stress hormones are secreted by the adrenal gland. The adrenal gland is this little triangular shaped gland. It sits right on the top of the kidney, and it secretes out these stress hormones when we have a perceived threat. So when we have a perceived threat, cortisol is secreted. If you have long-term excess cortisol in your bloodstream, a couple of things will happen. Number 1, we see an increase in weight gain. So it's very difficult for us to lose weight when we're under chronic stress. How many people can relate to that, right? And then number 2 is the concept of, if we have this over a long period of time, long-term we get diabetes or pre-diabetic based conditions. So, either way, these are not good outcomes. These are things that we definitely want to avoid. In contrast, when we look at adrenaline, and keep in mind, another word for adrenaline is epinephrine. So we can use those words synonymously today. We see that long-term excess adrenaline will lead to anxiousness and memory loss. Now, keep in mind, the reason why this happens, if you are all of a sudden walking in a park and all of a sudden you see, let's say, a snake that's going to come out of the grass and go toward you, the last thing you're worried about is trying to remember short-term things like, how to do a math problem or, a calculation or something. Your body's not worried about that. So it downregulates your memory and shifts all of the body's energy into your fight or flight response, which is the concept of the stress response. It's designed to help you get away or to fight and ward off a potential threat. Okay. So, when we have these issues, in regards to too much adrenaline, you can see why this ends up being what is the long-term consequence. When we talk about noradrenaline, we're actually talking about the ability of the body to be able to maintain and regulate sleep and wake cycles, okay? When we have too much noradrenaline in our body because we have excess stress from our lifestyle, we will notice long-term things like fatigue or difficulty with getting to sleep in the first place. And we also end up with lots of panic attacks because the body is chronically elevated. Our heart rate is up. Our blood pressure is up. Our eyes are, dilated. Our body is essentially ready to go. We're ready to sweat, right? So if you do this over a long period of time, the buffer or the threshold that has to be met in order for you to go into something like a panic attack ends up being very mild. So even small things can really push us into a place where we're on overwhelm and we end up in a panic attack. So keep in mind, the best ways to avoid all 3 of these concerns with cortisol, adrenaline, and noradrenaline is through looking at your lifestyle. So yes, we have genes that will predispose us to certain types of issues, but the lifestyle is oftentimes what drives in the concern in the long run. So we always talk about what can you eat, how can you move, what are your thoughts, and what's your structure looking like. I would also add in this category especially the concept of sleep and getting hydration. If you focus on those 5 areas of your lifestyle, you will dramatically reduce your likelihood of diabetes, panic attacks, memory loss, etc., and accordingly be able to live out the life that you're looking to in a much more easy and complete fashion. Keep in mind, when we're talking about panic attacks and we're talking about anxiety and anxiousness in general, I think it always helps to have ongoing regular strategies in our daily life, like a mindfulness and meditation practice, I think is a great idea. However, having spoken directly with people who suffer from panic attacks, telling them to meditate when they're in a panic attack is a complete ridiculous idea and is irrelevant and not helpful. So giving people an opportunity to try to think about some strategies that they can take part in if they are triggered in any way, then they have some things that they can fall back to that are more effective. Sometimes just leaving an environment entirely may be the best choice in the big picture for your overall health. So keep these in mind. Guys, ultimately, I want you to remember there's fundamental aspects of your health that must be met. If you're willing to provide your body with these types of ingredients on a regular basis, then inherently the body will function at a better level. You will avoid chronic disease in a big way, and you'll be able to live the life that you want all the way through your later years, still being functional, not having injuries, and not having chronic disease that makes it so that you can't reach your long-term goals. I hope this has been helpful for you. If you would like more specific information about how to live this type of lifestyle, please go to our website, www.alignedlifewellness.com. We are located here in Rancho Bernardo, which is in San Diego, California. We would love to reach out to you. If you need our help, we're happy to assist you. We'll look forward to seeing you guys soon at a future video. Take a look at our other videos on this page and make sure that you like and subscribe. Take care. Have a great week.